Our topic for this month's webinar is Counter Data Quality Improvement DHCS Center in Common Encounter Errors. I would like to introduce myself. My name is Felicia Orr, data specialist and I'm the moderator for this month's webinar. Today's agenda includes Encounter Data Specification Guidance, the X12 guides, the DHCS Documentation Center, Encounter Data Quality for trends, duplicate encounters, and the use of contact type warning. Will be DHCS
We understand that there's some odd issues. We're just going to put you on hold for a moment and see if we can figure it out.
Yeah, and this is Jeff Jennings. I'm speaking up. How is the sound for me? Is it also breaking up for me? Coming from me? Oh, yeah, well, I always sound great. I mean, you know, what can I say? Okay, so it's probably a local issue to Felicia's mic, perhaps headset, something like that. Felicia, because the sound was a bit spotty. If you're using a headset, you might want to try adjusting where the little arm is that picks up the sound. You know, that little arm thing.
I think we resolved.
Oh, okay, yeah. It sounds resolved. Okay.
Yeah.
Thanks.
Okay. The speakers for today will be Jeff Jennings, Christine Fessler, and Stephen Lefriver. The support staff are myself, Felicia Oropeza, Abby G, Mei Ying, Treon Ma, and Alvin Batista. For general questions, please submit your question to the WebEx chat. And please, your questions are visible to all participants because the host is not monitoring the chat. For specific questions, please reach out to the appropriate data mailbox, as will be instructed to the end of this presentation. Before we move on, a few things to note are that we're being recorded for documentation purposes. Linked webinar quality improvement efforts for part 1. The link to part 2 of the EDIP series for the 5 webinar includes the Encounter Data Quality Improvement 2. The link to part 3 of the EDIP series for the June 2025 webinar includes the Encounter Data Quality Improvement efforts for part 3. Recorded script and presentation material uploaded to Data Reporting and Monitoring webinar series. The glossary and FAQs are just updated here. As a reminder, turn off your microphone if you're not visible.
All right. I will go ahead and take over. So we're going to talk a little bit about implementation guides, companion guides, just how those work. I know that many of you already know this, but we're going to go ahead and take a review anyway, and then we'll talk about our documentation center as well, and technology. If it cooperates, I'll go ahead and share the doc center and kind of go over it. So yeah, and then as soon as I'm ready, I will say next slide. So thank you very much. All right. as I'm sure our trading partners are aware, we are all required to follow HIPAA administrative simplification rules regarding the use of data standards, data layouts, how we report claims encounters, and maybe many other data sets. HIPAA law requires that the data standards be maintained by the X12 organization and others, NCPDP, National, I always mess that up, but it's the Pharmacy Drug Program, National Council for Pharmacy Drug Programs. Some of the pharmacy data is submitted as encounter or claim data, but mostly for our purposes, NCPDP transactions are not used in the same way that they had been in years past. So we're not going to touch on those too much. Again, in terms of primary encounter data, the guidance on how to build a claim or an encounter and supply and submit it is contained in the X12 published 837 professional, 837 institutional, and 837 dental implementation guides. And the implementation guides are essentially a map to the entire standard / transaction. There are fields, I should back up and say, in the implementation guide, what's laid out is the rules for every data element, the elements that, or the values that can be used in an element, whether an element's required to be reported or is situational, only reported under certain circumstances, et cetera, et cetera. There are fields, data elements within the data standard that payers are allowed to customize, and those customized instructions and rules are then published in what is called the companion guide, because it's a companion to the implementation guide, and it follows the same publishing scheme, 837P, I, and D, professional, institutional, and dental accordingly. Next slide, please. And as I was saying, they work together, implementation guides, companion guides. You pretty much submitting data to DHCS, you're going to have to refer to both guides to be able to create an accepted claim or encounter. As I mentioned, implementation guides are the complete guide, companion guides are the customization, and please refer to both those guides when building any kind of claim encounter submission. Next slide. In terms of obtaining implementation guides, there are a few things to understand about that. First, X12 essentially owns the implementation guides. So those are considered X12 intellectual property, and as such, they're copyright and protected. X12 requests that payers or anybody that is licensing an implementation guide not share that with any trading partners or others, but instead encourage our trading partners to obtain their own copy of the implementation guide. Now, it used to be that X12 published those guides in a .pdf format, and that was actually pretty convenient. But the trend in the industry, due to the rise of ransomware and other hacking and things like that, other concerns, has been to move to online viewing solutions. And X12 has done just that. If you purchase an 837 professional claim implementation guide, at this time, you will not receive a PDF file or anything solid like that. Instead, you are granted access to Glass, which is the X12 online viewer. In my own opinion, it's a little less convenient than using a PDF. It does help X12 protect its very valuable property and to keep things secure. If you do need to get an implementation guide, the link that we have here on this slide will take you to the page that has all the information about that. And again, it's not so much purchasing an individual implementation guide any longer. You purchase a license that usually is good for about a year, and that license allows you different levels of access to the implementation guides that are available through the online viewing solution. If you do go to the X12 site and you've got further questions, they have mechanisms for you to contact them or Washington Publishing, which is their publishing arm, if you have any special needs, questions, things like that. Occasionally, if you ask really nicely, they may consent to share a PDF file, but for the most part, that's very much discouraged. Occasionally, I can help out too. You can always contact Jeff Jennings at dhcs.ca.gov, or better yet, send an email to dataexchange@dhcs.ca.gov. If you've got an X12 related item, I'll do my best to help out. Next slide. So these are the guides that we use for encounter data reporting, and also our companion guides. The current version of the X12 implementation guides is known as 5010. It was adopted quite some time ago. Upgrading X12 data standards is a long, somewhat convoluted process. X12 was hoping to have updated guides, updated versions about 2-3 years ago, but there have been some issues there. So we continue to use the 5010 versions of the implementation guide. And that's what X12 makes available through class, etc. In terms of companion guides, we make those available through our documentation center. And we're currently on version for the 837 institutional 3.9. The professional is 3.7, dental is 2.3. And those are updated anytime we have to make a change to our customized data collection instructions. If you are, for some of our training partners, there is the requirement to report pharmacy data. You can reach out to the various teams for more detail on that, including the data exchange mailbox. But just please note that we use NCPDP 2.2 version, which is an older version, as well as 4.2. 4.2 is probably the preferable. Next slide, please. So the documentation center, which is the solution we hit upon to share documentation without using the DHCS official internet site. There are some various conditions and requirements which make that not the easiest solution to use. And with the development of Microsoft Teams and SharePoint, which allows us to share materials with our external trading partners and to give our trading partners access to a site like this, we decided to create the DHCS Documentation Center to store not only documentation, but the various other artifacts that are associated with submitting encounter data and provider data and JSON-based data and all kinds of data. So this is kind of just a graphic that shows you the different guides that we have here in the documentation center, and what you can look to obtain there. I do want to give an example. Sharing Excel spreadsheets is prohibitive now. Various organizations have firewalls in place that will strip out your Excel file or block it or whatever. So again, there's certain items we can't even email to you, even if we wanted to. So again, the Doc Center is our solution. And we're always happy to grant access to this doc center, as you can see in the line at the bottom of the slide, data exchange at dhcs.ca.gov. Can you go to the next slide, please? I may attempt to share now. This is always fun, so I'm going to give that a try. Again, just a little bit more detail on the items that we have available in the doc center. And so let me see how well this works. I'll just take a few minutes to share the doc center with luck. And that's going to take away the slideshow presentation for the moment. So this is a view that I get when I navigate to the MS Teams Doc Center. I see this documentation center. I see the various channels that are available. At some point, we'll probably review the way this is set up and do a little bit of reorganization. We've kind of been developing this on an impromptu basis, but we're going to take a more planned approach going forward. And so to sort of illustrate where we keep things, it's always under the Files tab wherever possible. For example, here we have various forms of encounter data guidance, including the actual companion guides here. Sorry, to go back. Also encounter data coding guidance, which something is being developed by DHCS to help our special area managed care plan training partners report codes in a way that is more tailored to what DHCS needs. So again, that's what these are. I do want to cover a couple of things when it comes to the Doc Center. As you probably have noticed, it's based on SharePoint. So there are times when we share a link with you and it resolves as a SharePoint site. It's the same type of navigation, folders, files, that sort of thing. We've also noticed that sometimes the links don't resolve properly. We're researching that and looking at how to improve any link sharing that we use. You do not need additional, I'm just going to go ahead and respond to that one chat. You don't need special permission or anything like that. Just as Christine's answering, send in a request. So anyway, that's where these are. The data exchange mailbox can be used for questions, access, any issues you run into. We now use multi-factor authentication. There can be issues there. Generally, we can resolve those. Please contact us if you run into anything, any changes with MFA related stuff. I'm going to stop sharing the Doc Center now. We'll go back to the slideshow. And could I have the next slide, please? All right. So I know that was a quick look. We do have a document that we're updating. It's an overview document that will go more in depth on the tables of contents, the channels, many of the things that I've just touched on. While I was in that folder, what I didn't show you, but it's in there, are also guides to our validation response files, our error guides, schemas for some of the response files and JSON files that we publish. There's a whole wealth of data, of information in there. And again, our intention is to give you as complete guidance as we can. So these are, again, among the other things that you'll find in the Doc Center. Next slide. Right, so as we're touching on these resources, we've got coding guidance. We're working on modifiers. We are starting to expand our long-term care value code reporting guidance, as well as ECMCS modifiers. There isn't a limit to the number of users per organization doc center. I believe we've got I think it's a 10,000 person limit. So I think we're probably okay. If we do ever run into a need for limits, we will discuss that with our trading partners. Next slide. All right, so as I've kind of been mentioning, to access the doc center, please use that data exchange email address at the bottom, or any issues with access, et cetera, et cetera. All the companion guides that we use are published there. We, for behavioral health plans, traditionally, historically, companion guides have been shared through the DHCS SFTP folders, and behavioral health companion guides for short DOIL are still there, but we will be adding those to the documentation center over time. Whenever we update a companion guide or a technical guides are used as a guide to the JSON files, which are not subject to HIPAA law. Anytime we publish or update one of those guides, we send out a notification, usually with the guide attached if possible, and we also share links. And if we can't attach the guide, we definitely share links. So, and again, if you have any issues, just get in touch with us. We're always happy to answer questions, even suggestions. Those are appreciated. It's essentially a library for all of us to use, and we're definitely open to feedback. So thank you. I hope this helped explain a little bit. I know it was kind of rushed, but again, contact that data exchange mailbox. We're more than happy to answer other questions. Thanks.
Thank you, Jeff, for your presentation. And now I would like to introduce our next speaker, Christine Fessler, Chief of the Data Quality Reporting Unit, who will present on Encounter Data Quality Error Denial Trends.
All right, good morning. Thank you very much, Jeff. I'm not sure what the reporting unit team would do without Jeff or data exchange. Just to note, they, especially during the pandemic, really appreciate his ingenuity and his team's creativity to come up with a solution like the Doc Center. The reporting unit does leverage this. For some of you who got an email about the PADS HCPCS list, I think that is one of the things that Jeff had mentioned, that sometimes when we embed a link on our end as internal users, when we do test that link, we don't have issues. So it is important for us to know when we embed links in the emails, if there's an issue to our external trading partners being able to access that. So we do apologize for that kind of inconvenience. In our email communications going forward, we'll try to do a better job of like embedding maybe the folder directory just as not a link, but as text for you to kind of follow the folder path. But yes, our team especially loves that documentation center. All right, so just given that this webinar, the webinar series does go out to a broad audience for different healthcare delivery systems, I would just like to level set the definitions and the terms that DHCS and the reporting unit staff specifically use when speaking with our trading partners, managed care organizations, managed care plans, PACE organizations, that when we talk about encounter data, what we mean by encounter data. And just to also reiterate that this presentation is specifically targeted towards our medical managed care plans that are submitting the 837, the X12 EDI format. So, all right, what is a claim versus a post-adjudicated claim? All right, so I'm not sure why this screen isn't populating. If it has to be like you hit enter. There we go. Oh, this is an active one. Okay.
Yeah, more
All right.
Microsoft fun.
All right, I got to quiz myself. Okay, so do you know the definition? And like I just said, the encounter data is submitted on the X12, the 837 electronic data, the EDI formats. And so there are two types. There's the institutional and the professional. And what these are is when they're submitted to DHCS PACES, they represent the claims data or the encounters to members. And so when DHCS receives those encounters, they've already been adjudicated and paid to the provider by managed care plans. And again, this includes the medical, dental, and the behavioral managed care models. And so another thing just to kind of reiterate is, well, managed care organizations, managed care plans also submit 274 provider network files. So kind of another thing to talk about is how might provider enrollment impact how encounters are submitted. So again, we've got fee-for-service providers, and then we have the Medi-Cal. And so on the Medi-Cal side, those providers are enrolled by the managed care plans within those networks. So just some differences there. And if we could go to the next slide. All right, so the next couple of slides are just kind of more visual to demonstrate how the data flows when we're talking about the managed care encounter data. So again, the encounters, those are records of services received by Medi-Cal members from the providers that are enrolled in the managed care organizations or MCPs. And so here we see on the left-hand side in the bubble, you have the providers in delegated plans. And just to asterisk, because this is something that we will be talking about later on, is the contract type. And that is between the managed care organization, managed care plan, and the provider that is enrolled in their network. So down here, we do have some groupings, again, based on the contract code. And I've just bolded something for the audience to note, as that will be coming on later on. But going back to the encounters is, again, when we're talking about the capitated arrangements with the Medi-Cal managed care plans with DHCS, what happens is obviously the providers will submit the claim of the services to Medi-Cal members directly to the managed care plan. They have their own systems and processes to review those claims, which will either be accepted, rejected, and then the managed care plan will reimburse the provider. Now, what the managed care plan submits to DHCS, and that arrow is the post-adjudicated claims. So those are like the receipts, the records of the encounters that the members received during the reporting period. So again, these are submitted to DHCS PACES, SFTP. So if we could go to the next slide. This is the fee-for-service claims, just to kind of reiterate that this is obviously a different model. And the providers that are enrolled as fee-for-service providers, they submit their claims directly to CAMUS, which is a different system. And then the state controller's office will reimburse the providers directly. So very different model. Okay, so let's go ahead and go to the next slide, please. All right, so I get to play bad cop here. Stephen will be the good cop, but just is something, the resources that are available, and just kind of based on the questions that Data Exchange receives, the reporting unit, are questions that can be found with the available resources. So then we're asking ourselves, well, are these helpful to our trading partners? Is it the access issue? You know, kind of what's going on. So part of what we'll be going through in this presentation is to help you all understand how to use these resources better. Because just to allow the reporting unit and like data exchange to be able to focus on the really technical questions and needs, I just have a list here of what is really not an appropriate encounter data request to send to DHCS, which includes, you know, how should I name the file? What is the HCP? Where should I submit the files? Why was my encounter denied? You know, basically, these are all questions that can be found by reading the companion guide. And again, just pointing to the contract requirements, the boilerplate language with the managed care plans, as well as PACE organizations, is the agreement that the MCP has systems appropriate, like agreeing to, yes, we can submit high quality encounter data to DHCS. So this presentation will hopefully help you all understand how to access and utilize the resources within the documentation center. All right, next slide, please. All right, so this is one of the documents, the technical documents in the DHCS documentation center that Jeff briefly touched on during his presentation. And so this is really a key technical resource that all plans who are submitting encounters to PACES, the 837 files, they should be reviewing this. And so what this goes over is the validation response files that you all download. There's some of the, what we call the EVR codes, and those essentially are denoting whether a file was rejected. And then you also have issues where the encounters themselves can be rejected or denied, or there's those warning messages that show up. So again, the errors are the red lights. That's like, do not pass go. Those encounters will have to be corrected and resubmitted. There's also, this guide provides information on how to void encounters. And voiding is basically like you're deleting it. So it's erasing it from existence, essentially, as a way. But please do look at this custom error messages addenda. And I will be talking about why in the next couple of slides. All right, so part of what I wanted to show is some of the encounter data error trends. And you know, you've seen the reporting unit has done quite a few webinars this year talking about QMed 2.0 specifically for encounter data. So this is just to kind of highlight some of the top data quality issues with encounter data. And so this is year to date, the first half of 2025. And so what we have here is that 70% of all of the denied encounters, or those that receive an error code in your validation response file that need to be corrected, 70% is due to issues. And so what you see in this table here is a short message that comes out in the validation response file. So as you can see here, is duplicate encounter, not very descriptive. So this is where that, from the prior page, the PACES error message guide will really provide a lot more information that you all should be looking at to understand how to correct it, the error. So again, is duplicate encounter 50%? Wow. Okay, that's something that will be worked on. QMed 2.0, duplicate encounters is a message. And then the other one is whether or not the claim control number is unique. And so we can see 20%, those are being denied because of that. And again, so the claim control number is something that the managed care plans actually create themselves, that is submitted along with the encounter to DHCS PACES. So the PACES system has another identifier that is used to track the encounters. So it seems like maybe we need to work with the managed care plans to better understand, submitting, they really do need to come up with and submit the claim control numbers that are unique. So Stephen does have a few examples that we can kind of look at, walk through. And then especially in upcoming webinars, we will be focusing on the validation response files and going into more detail of these encounters errors. All right, so the other thing just to highlight here is contract amount missing and payer amount mismatch. So for QMed 2.0, down the road, the measures that we would like to incorporate, and it is our goal to incorporate, relates to payment information. So just to highlight here, it is a small percentage of the denied encounters, but this is very important information for DHCS and our reporting requirements. So, okay, if we could go to the next slide, please. Okay, so this is encounter warning trends. And if you look at the PACES error guide that I talked about 2 slides ago, the difference between an error and a warning message. So the error obviously results in encounter denying. A warning is like a yellow flashing light. Hey, look at this, needs to be addressed. Just to note, with DHCS, there are times when depending on the data needs and the system changes, we can convert warnings to errors. And so one of them that is that DHCS systems are working on right now is contract type. And so this relates to the CN 101 header. And again, this goes back to the type of contract that the provider has with the managed care plan. And so what we do see here is that is contract code 09 used. And so just to note, capitated plan should not be using contract type 09 as other. This is only for very, very specific situations. If you really cannot put any other contract type there, contract type 9 is specific to bundled payment arrangements where multiple services are grouped together under a single payment, and that's not really appropriate for capitated arrangements. So one of the things that DHCS is looking at, updating the companion guide to provide further clarification to our managed care plans that 09 should not be included as a contract type, and then potentially changing some of the systems, maybe looking at what other states do to make sure that this information is correctly reported for capitated plans. All right, so next slide, please. All right, so again, when we looked at breaking out the encounter error issues between the institutional, professional. Once again, for here, I show the professional that the top 2 errors are the same across the board. So again, issue with submitting duplicate encounters, and then the claim control number is not unique. So again, this is something we will be very focused on to clean up our data quality in the coming months and years. But I don't think it'll take years. We all know that you all are very vested in helping us submit high quality encounter data. So let's go to the next slide, please. All right. So again, this is just kind of for keeping you all apprised for encounter data. The focus for QMed 2.0 is, timely corrections of denials. And again, so we just looked at like 50% of denied encounters are from duplicates. And that for QMed 2.0, we will be really tightening up the measure to make sure it reflects the contract requirements for 15-day turnaround. And that is based on the date that PACES generates the validation response file, denoting that an encounter has been denied, that it's a 15-day turnaround for that to be corrected and resubmitted as either replacement or whatnot to the PACES system. And again, I talked about another thing we will be focusing on is the missing or incorrect payment amounts. So again, contract type 09, as I mentioned, something that could be converted from a warning to an error. And then, you know, from our perspective, updating companion guides, you know, kind of assessing if there's any other technical documentation that would be helpful to our managed care plans, submitting encounter data. So we welcome the feedback for what might be helpful for you. And again, we're hoping that this webinar will kind of help you all learn how to use the documentation center and those resources a bit better. So I think there's one last slide for my section here. All right. Yes, teamwork makes the dream work. I know we can do it. And so, yes, this is our focus to help you help us. And I am going to hand it off to Stephen to walk through a few real life examples of encounter data errors and how to problem solve using the resources available. All right, thank you all very much, and take it away, Stephen.
I'm working off of my laptop.
Okay, we can hear you, Stephen.
Okay. Well, before I start, I wanted just to shout out to Greg White. I hear you, Greg, and I pose the same question myself, and we're still going to be talking about that. So, anyway, my name is Stephen Lefebvre. I'm with the Data Quality Reporting Unit, formerly the Encounter Data Quality Unit. I've been working with Encounter Data and a lot of y'all for about the last 8 years. And today I'm going to talk about the companion guides and error guides. And I have talked to you all through the old EDQU webinar and this webinar about the companion guides 100 times, 1,000 times. I keep mentioning the companion guides, the companion guides, the companion guides. Well, I'm actually going to go into a different mode, and I'm going to give you practical examples of how the companion guides are used, because we keep saying use the companion guides, the information's in there. So I'm going to try to show you how to solve some problems just using the companion guides. So, usually we at DQRU provide support and guidance, and now we're kind of branching out to a little more training. Typically, plans request assistance with encounter denials or file rejections. And most of these issues can be resolved by referencing the companion guides, and we always help you, and we always will help you, but we want to empower you to help yourselves. Just a reminder, always, whenever you send in an inquiry about an encounter or a file, always include the file name, the encounter ID, the file ID to help us identify that. Otherwise, we can't really look up the problem. We don't really work in hypotheticals that much. We try to work, in a practical sense. So, and then, yeah, Jeff's mentioning the error guides. I'm also going to show a little bit about that too. Next slide.
Great, Stephen.
Okay, so we're going to go through some error scenarios, and I'm going to focus first on duplicate errors. Christine brought that up, and I just did an analysis myself. I'm working on the next webinar. I'm actually working on the next one, and in it, I looked back all the way to the beginning, the first file submissions back in 2015, and it's really frightening. Duplicate errors has been the #1 error every single month since 2015. So that's covered by section 3.8. in the companion guides called duplicate errors. The error code for that is 0x000cc, and the long message is this encounter is duplicate of an existing encounter. And you saw the short message in Christine's presentation. And so how do you see the long message? You got to go into the error addenda that Jeff was talking about. So it's again the most common error since inception. So, and next slide. Okay, so these are based on real scenarios. I'm not going to call anyone out. I'm just going to make this generic plan. But I recently had a scenario where the plan, they didn't understand why their encounter was denied as a duplicate error. And so what happened was the provider submitted an encounter, then they submitted an updated encounter. The reason was because the paid amount was being adjusted. So he sent it in as a second original. It wasn't a void or a replacement. So the plan packaged it up, forwarded the encounter in a file to Paces, which Paces denied the encounter as a duplicate because paid amounts are not part of the duplicate logic. The companion guides list out the duplicate logic for the different transaction types, and paid amount isn't one of those fields. So all fields within the duplicate logic were the same, and that resulted in the encounter being denied for duplicate. Next slide, please. So what would have been the proper action? Well, you update the encounter by submitting a replacement. And I'm going to show you the difference between institutional and professional duplicate logic in a minute. But in this case, they should have submitted a replacement because by sending a second original, all the fields in the duplicate logic were the same, and that's why it was denied. Again, the paid amount is not part of the duplicate logic. So never submit an updated encounter as a second original. Just please don't do that. Your other option is to submit a void and then update as a new original. You send the updated as a new original. So you always replace or void denied duplicates. So for this information, you just have to consult the companion guide, section 3.8. They're very detailed about, it's probably one of the largest sections in there for duplicate logic. So another scenario, that one's pretty basic, but it happens, and it does happen. So the second scenario is a plan they contacted me and they couldn't determine why their 837 professional encounter was being denied for being a duplicate. They felt that the attending provider was different. So they felt that because the attending provider was different in an encounter, that should have avoided the duplicate logic. So the plan noted section 3.8, 837 companion guide, and it's listing attending provider as one of the 11 fields. So the proper action for them to do was they should have consulted section 3.8 of the 837P companion guides, because 837P companion guide shows that 837 professional has only 5 fields in the duplicate logic. All those 5 fields were the same. Attending provider is not part of the duplicate logic for 837 professional. So because of that, I'm sorry, it has 6 fields. This is got a typo. But because all 6 of those fields in the 837 professional were the same, and attending provider, a different attending provider, is not included in that duplicate logic, it was denied for duplicate. So the plan was looking at the wrong companion guide. It was that simple. But we only figured this out by looking in the companion guide at the list of the duplicate logic. So those are a couple of very easy ones. I'm going to get into a little bit of red meat in a minute here. So, but I wanted to show you the difference between the duplicate logic and the transaction types. So the main 2 transaction types are 837I, institutional, and then professional, which is on the right. And if you see, there's 11 fields in the institutional duplicate logic, and they're listed here. And if you look at the duplicate logic for the professional, there's only 6. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, 6. And attending provider is not one of them. So that was the problem. It was a very simple problem, but they just were looking at the wrong reference. Okay, so this is a really fun one. Okay, so there's the scenarios. There's a, this is an actual scenario I dealt with. This is an MCP, and they have 2 different HCP codes for 2 different counties, and they're listed here, 998, 999. So these are, I used our test encounter codes because I didn't want to call anyone out. So they experienced the following errors. They got their EVR back, and their EVR had all these errors. 0x0019A, 0x0019F, 0x001A5. So what I'm trying to do here is show you that I solved this problem just by using the documents that we provide, because we keep telling you to use them, but I'm showing you here. So I don't remember all these. There's well over 100 error codes. And even though I work with this every day, I can't memorize most of these codes. I have to use a reference. So I myself use these documents. I referenced all of these in the custom error messages addenda. And with that, I was able to look at define the error codes. So the error code for the first one was HTTP code mismatch between ISA 06 and CN104. That was in the EVR. The error code for the the message for the second error was HTTP code mismatch between CN104 and file name. And anytime you see those little fancy little brackets, that means that is an error that can use multiple fields within the X12, and it just puts in the relevant one. The next one is the next error message was HTTP code mismatch between CLM01 and CM104. Again, I found those errors, so I looked in the error addenda, and in the error addenda, what are these? What are they, and how do we fix them? What are all these errors about? I mean, it looks daunting. There's a bunch of really technical sounding errors. What are these fields too? ISA 06, CLM 01. What are these fields, and how are they interconnected, and why all these mismatches? So I went into the companion guide and I looked up ISA 06. Well, ISA 06 is called Interchange Sender ID. This is the ID of who's sending the encounter. So what does it consist of? It is the federal tax ID, 9 digits, no hyphens, plus added to that 3 digits for the HCP code, which plan code, and then 3 spaces. So again, I found this definition. I defined this by looking in the 837I companion guide, section 3.10, and specifically ISA IEA. It provided all these parameters to me. So now I know what this first field is. It's the interchange sender ID. It's who sent it. What's CN104 is the next reference identification. So it's a CN104 reference identification. That's simply just a 3-digit HCP code. So CN104 in the X12 is 3-digit plan code. How did I figure that out? I referenced the companion guide for institutional, section 3.35 claim level detail. So now I've identified ISA 06, CN104. So now at least I know what fields we're talking about here, some of them. Keep going. Let's go to the next one. And then the next one that was referenced is CLM01, claim control number. This is another field that it's literally called claim control number. This is a unique number determined by the plan. This is kind of how you inventory. This is how a plan would inventory, put an inventory marker on their encounters so they can identify them themselves. This is your internal number. When we reference, we use encounter ID. That's a number we assign. but your own number is for you to use when you're inventorying. What is it? It's a unique number determined by the plan. The first 3 digits must be the HCP code of the beneficiary. So I'm figuring out what is this code. And then there's up to 38 digits alphanumeric and hyphens. So it's 3-digit HCP code and as many digits as you want, alphanumeric with hyphens. And this is how you can create your inventory system. I've got an asterisk there because in NCPDP, it's only limited to 13 numeric digits for this claim control number. But we're talking about 837I here. So how did I figure this out? What is CLM01? Well, I referenced it in the companion guide, section 3.23, identification. So next slide, please. So I hope you see I'm going through a process. First thing I'm doing is I've got a bunch of errors and it's referencing codes. I need to figure out what those codes are. So the next one was it mentioned file name. Okay, the file name. This is the file naming convention. So it starts out with the plan name, then it goes to HCP code, the next after the underscore, and in this case 999, and then the transaction type 837I, institutional, then MCE, which always means managed care encounter, and then the date stamp, which is 4-digit year, 2-digit month, 2-digit day. And then after the next underscore is a numeric identifier. This is a number that you put in at your plan to inventory. If you're doing multiple files per day, then you can number them 01, 02, 03, 04, 05, and then the file extension. And where did I find all of this information? I referenced the companion guide, section 3.6, submitted encounter file naming convention. That's what it's called. So now I've identified all the fields that were contained in those error messages. So I know what they are. So now I can start figuring out why there's a problem. So, okay, next slide, please. So this is a mock-up of the data input for the encounter. So the ISA 06, which is the interchange set number, is the 9-digit tax code. Again, we're seeing then the plan code 999, then 3 spaces. Then CN104 is the HCP code 998, and then CLM01 is the plan code 999, then up to 38 digits. And then there's the file name 999. So I hope you see where I'm going here. This is what the plan had in this encounter. Next slide. Okay, so let's review the messages again. 19A, HCP code mismatch between ISA 06 and CN104. Next one, 1A5, HCP code mismatch between CLM01 and CN104. 19F, HCP code mismatch between, I'm sorry, I got a pop-up, mismatch between CN104 and file name. So what's the common denominator? Let's look at the next slide. And common denominator was CN104 had the wrong number. CN104 had 998. That's that 3-digit plan code. The file name had 999. The ISA 05, 06 had 999. And the claim identifier number had 999, but the HCP code was 998. So they didn't coincide. That's what those errors were all indicating. They were all pointing us to, and it was by using the companion guide, I was able to define each of these fields. I was able to, using the error addenda, I was able to get a clear definition of the errors. And then with all that information, I was able to say, oh, okay, this segment, which was the HCP code, doesn't match in all of these segments because CN104 was wrong. So that's how I figured it out. It looked like a really daunting problem, a bunch of errors, and they were very technical sounding. But once I broke it down and I used the companion guides and I defined the errors, I defined the fields, I was able to easily put it together. So how do we correct this encounter? Well, the easiest way would be to correct CN104, put in the correct HCP code. In this case would have been 999. And then you can submit a replacement, which was recommended, Or if you feel like it, you can void that encounter completely and then resubmit it as a new encounter. So the companion guide conclusion. I know that for some of you that was probably rudimentary. There's some plans I've been working with for a long time that have been with us from the start. We have a lot of new onboarding plans, so I hope you can see how useful the companion guides can be with just those small scenarios. But there's a whole bunch of other information in these companion guides. There's file level guidance, okay, the X12 format. And in file level guidance, you're going to find general file submission information, allowable number of transactions, encounters, service lines. It'll let you know how many you can put in there. File header guidance, and it includes tables to demonstrate the file header guidance. We get a lot of most file rejections are simply header problems. So with that guidance, you can probably figure out what the problem is with your file name. And, there's also transaction level guidance, void and replacement scenarios, data element separator use. That's the little asterisks or the tildes inside the segments of the encounter file. Segment terminator use, letting it know how to let the file know this segment this is done, so you can go to the next segment. And that gives the companion guides give encounter level guidance. It talks about Medicare crossover claims guidance. And this is a big one. It's got a lot of information on encounter level guidance. How to avoid or correct duplicate encounters. It's the biggest section there. It will tell you how to do it. How to use modifiers. That's in the encounter level guidance, and specifically in the duplicate guidance. Correcting a submitted encounter. Loop IDs. It'll tell you about the interchange control headers and numbers. The ISA 01, 02, all the way to ISA 15. It defines each one of those. Other loop IDs include GS and GE for group headers and numbers, transaction set headers and numbers. Those are the ST and SE segments. Provider identifier segments, community supports housing services information, and there's more tables, including header, provider, payer, and patient tables that give you a lot of definition, so you know exactly, if you've got a problem, you'll know exactly what it's supposed to be like. And there's large tables with claim and service line details. Then there's service line level guidance. It talks about coding, paid amounts, modifiers guidance. That's all in there. All those definitions are in there. DRG code guidance, data related group guidance, and how to submit PADs. It's another thing we deal with a lot. How to submit physician administered drugs, and that one's very important because that relates directly to the 340B drug rebate program. And if you want your providers to get reimbursed for administering physician administered drugs, then they have to be correct. Otherwise, our capitated rates division can't pay those. And it also gives a lot of general information. Response file naming conventions. We already talked about how I looked that up and where I looked that up. Types of response files. It talks about the response files, 999 files, 277 files. They're all DAT files. And we're going to go over that in a future webinar. We're going to talk about response files and how to use them for reference in order to track down errors. It talks about XML files for EVRs also, and there's over a dozen very detailed void and replacement scenarios. It literally gives you very step-by-step examples of how to void or replace files. So it's all in there. And we're not just pushing you off saying, go look at the companion guide, go look at the companion guide. We're not doing that. We're trying to point you to the exact information to empower you so you can help yourselves without having to send us an inquiry and then waiting for a response. So that's the whole purpose of this, was to show you how to use them in a few scenarios and let you know you can do this yourself. You don't necessarily need to contact us. And if there's something that you just can't find in there, or if it's something that even we can't answer very easily and we have to go to the PACES people to do that, then that's fine. Then we can take those inquiries. But a lot of your inquiries can be resolved immediately in an immediate sense if you just check the companion guides. So, okay, so that kind of concludes my companion guide sermon. So, but I just wanted to talk one last thing about the upcoming webinar schedule. It's being shifted around a little bit. But next month, we're going to look at some of the QMed 2.0 new measures. And there is going to be measures for duplicate service lines. I know back during the EDQU webinar, quarterly webinars, I was doing a little preaching on duplicate service lines. And and I did let everyone know this is going to be coming. It's going to be something that you're going to be accountable for. So these are going to have to be dealt with, duplicate service lines. Also denied encounters, there's going for, in general denied encounters, I believe Christine touched on that. So, and then October, we're going to talk about the QMed. We're on schedule to talk about the QMed all plan letter. And that was, so then November, plan data feed. This is the file submission process in SFTP and Move It, e-transfer. And then in December, we're going to talk about encounter errors returned to medical MCPs, questions on, we're going to field questions on QMed 2, and we're going to talk about national drug codes for physician administered drugs. That PADS HCPCS list that we send out every month. So these are some upcoming topics. And then, just looking ahead in January, I'm already kind of brainstorming on putting together a presentation on, like I said, how to interpret and read the EVRs so that you can use that information to track down the problems that you're having with your encounters. So that's also in our near future. So that concludes my segment of this presentation. I want to thank you all for bearing with me through that all. Thank you all for attending. And with that, I'm going to hand it back to Felicia. And have a great, great day.
Now we're going to.
Sorry, go ahead.
Questions?
I would like to make a couple of comments, if possible.
Okay.
Yeah. We do have a number of questions about duplicates in the chat. If we are unable to address those right today, we will address those in a follow-up. We realize that duplicate submissions are a real area of focus and need a lot of discussion. I'm thinking of what Kim Phillips had put in about duplicate scenarios. As we identify ones which aren't covered in the companion guide, we'll do that. We'll go ahead and get those added to the companion guide. We certainly want to give you all the guidance that we can. I also want to point out that we realize we have county plans on the call and that we have long-term care plans which have some variance in how they report. For example, long-term care plans use the pharmacy transaction, et cetera, et cetera. We're aware of all of that, and we are constantly discussing how to improve the content that we offer here in the webinars. Suggestions are welcome, as are suggestions for anything that can be added to documentation that will be helpful. So just kind of wanted to throw that out there. We'll work to address county concerns and long-term care plan concerns, as well as some of the other things that have been raised in the chat, et cetera, in the coming months. So thank you so much. And that was my spiel. So we do have some questions in the chat. Can we address those?
Yes.
Or do we need some time? Okay, thank you, Felicia.
No problem. We're going to address Arjit's question. And that was, right.
Yeah, we just want to verify, Arjit, is this the slide that we have up? Is this the one you have a question on?
Yes. Do you have any questions?
Yes, it is, Alvin. Great. Glad you got the screenshot. Thank you, Arjit. So again, we do have some questions in the chat. Are we going to have the time to acknowledge those today, or are they going to be follow-up? We've got a few different coding and duplicate questions here.
Yeah, Jeff.
Yeah.
You had mentioned earlier that we're probably going to be talking a little bit more about modifiers. Information about modifiers will be in the duplicate scenario section, duplicate encounter section of the companion guide, section 3.8. But I think you did mention that we're going to be taking a deeper look at that because we're kind of picking out different low-hanging fruit and trying to give the plans a little more guidance on that. So am I correct? Did you
Yeah,
talk
yeah.
about
I mean,
how we're going to elaborate on those?
We have a lot of moving parts and a lot of initiatives going on behind the scenes. Contract type codes have come up recently. So we're looking at developing more detailed guidance on contract type code usage, as well as other codes, modifiers, etc. And again, obviously duplicates are a big area of concern, as is adding further detail and instructions to our various guidance publications. So these are all things that we're very aware of, and our intent and focus is on improvement overall. I know that sounds kind of vague. It will take us time to develop some of this material, and that's what we're looking at over the next few months and weeks. We'll publish as soon as we can. So yeah, Stephen, that's kind of what I was hoping to communicate. All right, so I am thinking probably some of these duplicate questions need some time on our side to follow up with, so we'll be distributing answers to some of those that came in the last few minutes with a follow-up document, which is what we normally do with these webinars. So if we are going to address any questions today, please let's do so. Otherwise, I think this might be a good time to wind things up and thank everybody for their attention. Oh, and I guess we do have one more section, so thank you. I'll go ahead and speak to the communication part. Next slide, please. So as usual, we're listing the different mailboxes that are used for depending on what you're trying to find out. Like any good idea, maybe mailboxes are really proliferating, but it is a way for us to focus on certain subject matter and certain teams that really are the subject matter experts. So right now, mailboxes are very helpful for us. We just appreciate you making note of the various points of contact as listed there. There are different mailboxes to use depending on what it is that you have in mind. So please make note of these and go ahead and use the urgent in brackets in your subject line. That helps. So why don't we go to any further slide that we have?
And we will be covering resources next. Thank you, Jeff. And next slide, we will be looking at behavioral health managed care resources, online resources, and dental managed care online resources, and programs for all-inclusive care for the elderly, PACE organizations, online resources, and medical managed care program online resources. And lastly, technical support online resources. And I believe one other person had a question. I believe it was Christine. She raised her hand.
Oh yeah, so it's not so much a question, it's going back to the emails that Jeff was saying. So yes, if it's an urgent question in the subject line, but as Stephen mentioned, please, 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 it really helps us get to questions faster if in the subject line you include, is it missing response file? And then what type of environment? Is it the PACE's staging, testing, or the production? And then in the body of the email, things like the file name. If it relates to an error with the 837, please include the details, especially as we pass that along to our technical experts on the PACES team. That's who we send these technical questions to, and it really helps expedite the well, it reduces the back and forth that our team has to do with you all about, the additional information that is needed for the PACES team to investigate the various aspects of the 837 transaction structures, such as if it's something that relates to a header, if it's something that relates to the different file segments, please include that information so we don't have to go back and forth. So thank you very much.
Thank you, Christine. And thank you to all the presenters today and the support staff who helped contribute to this presentation. And for our next preview, our next webinar preview for September 2025 webinar, we will focus on the QMID 2.0 new measures. And the date for that webinar would be September 24th, 2025. And the time would be 10 a.m. to 11:30 a.m. And thank you everyone once again. And also as a reminder, please send any further questions and comments about the webinar series to our email mcdss@dhcs.ca.gov. Thank you.